My name is Kit Vaughan. I'm the Chief Executive Officer of CapeRay Medical Pty Limited, and our product is known as Akeso, and this is a system that is used to detect breast cancer.
Can you tell us exactly what it is? I understand it's a kind of a hybridized combination of X-ray and ultrasound.
Yes. If you consider this, women today, 1 in 8 of them during her lifetime will be diagnosed with breast cancer. So that's the bad news. The good news is, if detected early enough, the breast cancer can be treated successfully. The method by which it's normally detected is X-rays or mammography. However, X-rays don't do a very good job when the woman has dense breasts, and this very often happens in women aged between 40 and 50. And so what we've come up with is a method by which you can not only take an X-ray of the breast, a mammogram, but at the same time you can also do an ultrasound and gather an ultrasound image. And the combination of X-ray and ultrasound gives us a very good way of identifying breast cancer at an early stage.
And what you've created here, is it unique? Is it a unique product?
It is indeed unique. There is no other product like this on the market anywhere in the world. There have been some attempts by some of the major companies over the last number of years, but none of them have yet succeeded. And the exciting thing about our product, the Akeso, is that we will be taking it in the next week to the University of Cape Town, where we'll be running a clinical trial on 50 healthy volunteers, plus about 20 women who have confirmed breast cancer. And this will be the first test that it will have in a proper clinical setting.
What's been the reaction to this?
I think there's a lot of excitement, a lot of anticipation. We are in touch with people all over the world. We've exhibited at international conferences. So I think people want to know, is this system for real? And so we're at that very exciting tipping point, if you like, where we will be able to show the world what it is that we have, and from there complete the commercialization process. So the clinical trial is one of the early stages, but then one needs to have independent testing. It needs to be certified by international bodies such as the International Standards Organization. We'd need to get a CE mark. We'd need to get FDA approval to sell it in America. So that's the current status. We're at that, as I said, tipping point, very exciting, about to start a clinical trial.
And the future, what are your hopes and thoughts about the future?
Because this is a product that has a world market, not only a market here in South Africa and in Africa, that obviously is an important market for us, but internationally it really has got huge opportunities. And so our plan is to partner with a major international company who will be able to assist us with the distribution of this product. And we're currently in discussions with 2 such companies. And we believe that this will be part of the success for getting it into the places in the world where it can really make a difference, and that is in the lives of women.
And what are your thoughts in terms of time frame? Is this the next stage?
Yeah, it's the next stage. We anticipate being able to secure the regulatory approval before the end of the year, and by March of 2015 have sold our first few systems. So the next couple of months are really important for us. One of the reasons we're participating in the YouStart program is that we are looking to secure another round of financing at the present.
One last question. How did you get this far?
We have been funded so far by the Industrial Development Corporation of South Africa. I've put some of my own money in. We're a spin-out from the University of Cape Town. So we started as being incubated within UCT, but within the last 4 years we spun out from the university, and the major funder, as I indicated, was the IDC, and I've also put money into the enterprise.
As an innovator, very last question, as an innovator, how have you found South Africa in terms of helping you with your innovation?
No, there's no 2 ways about it. There's a lot of innovation that comes out of South Africa. It's also fair to say that the area in which we are competing, and make no mistake, we are going to be competing with big companies like Philips and Siemens and GE. It's going to be difficult for us, but that doesn't mean that we as South Africans should step aside or in any way fear the opportunity to innovate and to introduce innovative products into the world marketplace. And that's something that really excites me as well.